Hello, everyone. Welcome to my first exclusive podcast by Dr. Tam. I'm Dr. Setu. Today, I will be talking about the issue that's gaining a global attention of health, weight management, and particularly obesity management. My topic today is about sarcopenic obesity, a dual threat to aging and metabolic health. Are you ready to dive into our topic today? If yes, here we go. The true elegance of the human body is defined not only by the face, but is defined by the vitality of our muscle. Beyond athletics, muscle is the true beauty of the human body. It's strong, vital, and essential for health because the muscle is more than strength in our body. It's a vital organ system, essential for body metabolism, metabolic health, resilience, survival, and longevity. When we're talking about the skeletal muscle, we focus on the function that is very important for the two crucial functions of skeletal muscle. The first one is about structural function. Skeletal muscle is control our movement, posture, balance, and also strength. And the one function is very important to our body is about metabolic and endocrine function. As we know, skeletal muscle is a reservoir of amino acids that preserves our energy during the movement, we have the exercise, stress, and also during illness. And muscle, they can synthesize and store amino acids glutamine. Glutamine is very crucial amino acids for our body in the role of immune system and also gut health. One of the important function of skeletal muscle is act as the endocrine organ because it can produce many of biosignaling marker. One of these is myokine. Myokine is biosignaling molecule that produced from skeletal muscle. It take action throughout our body from the brain and to the tube. In this picture, you can see that myokine production is can uh, take action from the immune system, bone, muscle, brain, and also vascular health. The skeletal muscle can produce the myokine in response to movement and also exercise. And myokine can take action as the hormone to our body and can communicate to many organs in our body system, including brain, bone, and vascular health, gut health, liver, pancreas, adipose tissue, immune function, immune system, and muscle itself as well too. And in this picture, you can see that myokine, for example, be brain BDNF, brain derived neurotrophic factor, is take the important action to our brain goals, our neuron. Ellipsin is one of the hormones that is very crucial for metabolic control. But one of myokine that gain about the attention in many of study is interleukin 6. Interleukin 6 is produced from skeletal muscle cell and is have multi-function in our body. Interleukin 6 it can produce or stimulate of fat burn and fat oxidation is enhanced about the glucose uptake to the muscle cell and glucose metabolism. And also interleukin 6 is an immunomodulator. And one of the important functions of IL-6 is anti-inflammatory myokine. So muscle is very important, not only for structural function, but also for metabolic and endocrine function. Skeletal muscle mass and strength is generally peaks by the mid 20 to 30 years of our lives. But unfortunately, you can see from this picture, muscle mass and also muscle strength decrease by approximately around 3 to 8% per decade after age 30. And when we reach to 60 years old, the rate is more speed up. And when the people that is around 70-year-old, muscle mass is declined around 10 to 15% per decade. So we need to preserve, we need to build muscle in the early lives. It's very important. And how about muscle strength and muscle power? In this picture, it shows about early lives, adult life, and older lives of human. The muscle strength and muscle power across the lifetime, they have varied. In the early lives, the muscle strength and also power is maximized peak around 30 to maybe until 40 years old, we still have more muscle strength and muscle power. And after that, when we go to adult life, if we not train muscle well, muscle strength will be dropped to under the threshold of low physical performance threshold. This threshold is very important because in our daily activity, we need muscle strength and also muscle power, right? In some people who not training muscle well, this strength and power will be rapidly drop, maybe until the threshold of disability. And in the older life, it's very, very important periods in our lives because some case in elderly, muscle strength and also muscle power that drop below the threshold of disability. So it's bringing to many risks of chronic disease, particularly NCD, heart disease, and also musculoskeletal disease. We call the condition of low muscle strength as dynapenia and low of muscle power as powerpenia. Muscle power is the first thing that drop before muscle strength and also muscle mass. So right now, if you don't training your muscle well, you not regularly exercise, your muscle power will be dropped. So quickly than muscle strength and muscle mass. So I think exercise plan is very important to maintain your muscle power, muscle strength, and also muscle mass. To prevent or delay muscle loss, the aim is to maximize muscle in the youth and adulthood, maintain muscle in middle age, and minimize loss in the older age. This is our mission, right? And how about aging-related change in skeletal muscle structure and function? In this picture, it shows normal muscle fiber in adult life, muscle mass increase, and body fat is lower than muscle fiber. We can see healthy mitochondria. Mitochondria is one of the organelles in our cell. It's like the powerhouse of cell. If the muscle they have abundance of mitochondria, is represent of the healthy muscle. When we have aging process occur, muscle fiber is atrophy fiber. Muscle mass lower and is replaced by body fat. And how about mitochondria? Mitochondria is changed both size and quality. So mitochondrial dysfunction is one of the main cause of muscle change. We call this condition is sarcopenia. And in this picture, it clearly show you about the MRI of two thighs muscle. From your right side, it show about the muscle mass in young, healthy thighs muscle. Muscle mass size is bigger than the fat mass, and in the opposite picture, in the your left side, it shows lower of muscle mass, fragmented, and infiltrated by body fat mass, and together with connective tissue. So when the muscle mass is lower, muscle strength is lower, is common is a common character of muscle change when we have aging occur, and especially when we have increased body fat in size. So lower muscle, increased body fat is very important thing that we need to screening and we need to prevent in the future. And what is sarcopenia? Sarcopenia in Asian, they have the Asian Working Group for Sarcopenia or AWGS and update in 2019. They define sarcopenia as age-related loss of muscle mass together with low muscle strength and or low physical performance. If you have the case or your patient who suspected about sarcopenia, you need to screening first with the questionnaire or simple tool. And if it's positive, we need to confirm sarcopenia by the criteria diagnosis of sarcopenia of AWGS 2019. We start with test of muscle strength by hand grip dynamometer or the other test, and we need to confirm about low muscle mass by the body composition analysis. It may be use of DEXA scan or the bioimpedance analysis and test of the physical performance. So I will talk later after this. And what happens when we have more aging and obesity? In this picture, it showed three types of older adult. The first one, healthy older adult, they have active lifestyle, independent, they have the large muscle mass and minimal of fat inside. But sarcopenic older adult, their posture is changed, they look low energy, they look dependent, and the deep inside it show lower of muscle mass. It maybe increase a little of body fat. But in the third picture, sarcopenic older adult, they show very large, very increase of the body fat mass and lower of the muscle mass. So this phenotype is very dangerous because it's not only obesity, it's not only sarcopenia, but it's come together. We call this condition as sarcopenic obesity. And in this picture, it clearly shows you that when we have normal muscle mass and aging is occur, uh, the muscle size and also muscle strength is lower, but body fat is not increased. So it shows only of sarcopenic older adult phenotypes. But what happens when we have more body fat inside together with the muscle is have the lower function and also lower muscle mass. The sarcopenic obesity is not only shown in the elderly, but right now we found many of the younger people they have this condition because if when they have increased the or excess body fat inside our body, particularly the body fat in the muscle cell, or we call intramyocellular lipid. The fat in the muscle is take action in many mechanisms. One of these is mitochondrial dysfunction, chronic inflammation, and insulin resistance. As we know, insulin is a hormone that uh, support about muscle mass or muscle protein synthesis. If we have insulin resistance in the skeletal muscle, so our muscle cannot make more muscle mass. We call anabolic resistant state. And in this picture, you can also see about the chain of tight muscle fiber from the normal muscle to the sarcopenic uh, and increase the fat in the muscle fiber. The chain from muscle type 1 to the muscle fiber type 2X. This one is a different chains of the muscle fiber in the people who have obesity and together with low of muscle mass. So my summary is obesity is lead to significant alteration in skeletal muscle beyond change in size, and volume. And what happens when we have more aging? This picture can summarize the thing that I mentioned before. Aging with obesity is increased energy burden. It changes the mitochondrial function in our cell, especially in the muscle cell, increase the oxidative stress, decrease the satellite cell in the muscle, and decrease the myocyte differentiation together with lower protein turnover. It means lower the muscle protein synthesis. All of these mechanisms make increased risk of frailty, increased risk of weakness in elderly, and lower about locomotor function, bring to sarcopenic obesity. Definition of sarcopenic obesity is defined by ESPEN and EASO consensus statement in 2022. They define as sarcopenic obesity is a coexistence of excess adiposity or body fat with low muscle mass and or muscle function. So this condition is come together, obesity and sarcopenia. This diagram that shows four phenotypes of the adult body: healthy weight, sarcopenia, obesity, and sarcopenic obesity. Sarcopenic obesity is more dangerous when we compare to sarcopenia or obesity alone. The question is why sarcopenic obesity is more dangerous than sarcopenia. In this picture, they show about many risks of sarcopenic obesity over sarcopenia because sarcopenic obesity or HO is increase the risk of cardiovascular disease, cancer, diabetes, fracture, frailty, disability, morbidity, mortality, and lower about quality of life. And from the Nature Review Endocrinology 2024, they summarize about many risks of sarcopenic obesity when we compare to sarcopenia. And how about mortality? Mortality of sarcopenia from the hazard ratio is about 1.3 to 1.9. But the sarcopenic obesity, the mortality rate is double, is around 1.9 to 2.5. And pathophysiology of sarcopenic obesity, there come with many of causes of pathophysiology. The first one is about the change of the hormone in our body, especially sex hormone, testosterone, estrogen, progesterone, and many of hormones in our body is changes. Growth hormone is one of the hormones that link to the fat and also muscle as well. Inflammation, oxidative stress, insulin resistance, inefficient autophagy, mitochondrial dysfunction, and imbalance of adipokine and myokine in our body. All of the pathophysiology that makes sarcopenic obesity has occurred and increased about many risks, many disease, especially the chronic disease, as this picture shows. And what is the common cause of sarcopenic obesity? As we know, sarcopenic obesity is increased the risk when we have more age, right? So aging is one of the factors that contribute to sarcopenic obesity. Unhealthy diet, ultra-processed food, refined carbohydrate, and unhealthy fat, together with lack of exercise, sedentary lifestyle, all of these factors are multi-factors that contribute to this condition because they increase about the fat inside or augmental fat deposition, ectopic fat deposition, insulin resistance, lower metabolic rate, and low physical activity, and lower of anabolic hormone that I mentioned. Sarcopenic obesity is characterized by adipose tissue expansion or the fat cell increase. As we know, when the fat cell that increase in size and the function is changed, is make the fat cell more inflamed. When they're inflamed, they produce more pro-inflammatory cytokine, and this all of these cytokine, they will lead to the condition as insulin resistance in our body. So it will be like the vicious cycle in our body. When you have more body fat, you have more insulin resistance, and the insulin resistance make your body gain more fat. And finally, it's bring to the condition of increase of body fat and anabolic resistance, lower of muscle synthesis. And one scenario or situation you can see in your common practice, or you can see from your friend, your family member, or many of people is weight cycling. Weight cycling is defined as when you try to lose weight with maybe many of methods such as restrict your diet, exercise, intermittent fasting, or maybe medication. And after that, you cannot maintain your body weight for a long time. You gain weight maybe in the same level or beyond the same level. We call one time of the weight loss and weight regain as weight cycling. In this paper, they show about information of weight cycling as a risk factor for low muscle mass and also muscle strength in population of males and female with obesity. And the data show information that when you have weight cycling more than 5 cycles, you have risk of sarcopenia around 50%. So it's very important. When you have a weight loss plan, please use the proper method or the treatment of the weight loss and choose be the uh, the good method or the treatment guideline and follow to maintain your healthy weight for a long time, because if you have the weight loss more quickly, then you have more risk to regaining your body weight, and weight cycling is maybe occur after that. By comparison with non-pharmacological, the caloric restriction study that show a smaller magnitude of weight loss result in 10 to 15% or around 25% of fat-free mass or lean mass loss. But by medication, especially GLP-1 receptor agonist, as we know right now, it's the era of GLP-1 receptor agonist medication, because this medication can help many people to lose weight more and quick. In the people who use this medication, they have information that is decreased fat-free mass, maybe around 25 to 39% over 36 to 72 weeks. So when you have your patient or during you use this medication, it's very important to keep your body weight with a healthy weight. Get enough protein, high quality protein, regular diet, particularly resistant exercise is very important to make your muscle strength, muscle mass, and preserve your fat free mass during you have the weight loss phase and also weight maintenance. And I will summary with this picture. In obesity management, muscle-related goal is very important, because if you have suboptimal treatment for your patient, such as you restrict more diet, you restrict more calorie, and non-adequate exercise or nutrition, or more stress, or it take a short time of weight loss, your kid or your patient will have more risk of sarcopenic obesity, because their loss of muscle mass, they increase the risk of weight cycling and increase the sarcopenia when they have aging. In this condition, we call the people they have poor metabolic health. So our goal should be reduce body fat or adiposity first, and optimize muscle mass by optimal protein, optimal nutrient dense diet program, and structural exercise program with weight training, cardio exercise, and lifestyle intervention should be implemented and applied in our program to make your patient have a healthy weight loss program. To preserve or increase muscle mass is very crucial and can make about the success of weight maintenance in the future. How about diagnosis of sarcopenic obesity? As I mentioned, ESPN and EASO consensus 2022, they give about the 3 steps of screening, diagnosis, and staging of sarcopenic obesity. We start with screening who had the high risk case of obesity, of sarcopenia. We can use the simple tools such as BMI with circumference to screening about obesity and use about the clinical symptom, clinical suspension, questionnaire such as HARCS questionnaire in other subject to screening about sarcopenia. If two are positive, then we go to diagnosis stage, diagnosis for sarcopenia, diagnosis for obesity, and then go to staging. They have stage 1 and also stage 2. So we will look deeper insights about the screening method. Screening of obesity, we can use BMI or weight circumference based on ethnic cutoff point, such as in Asian population, we use BMI of 20 greater than or equal to 25 kilogram per meter square, right, for Asian population. And with circumference, we use the with circumference greater than or equal to 90 centimeters for male and 80 centimeters for female in Asian population. And you can also use the calf circumference or CC. You can measure in the wideness of the calf muscle. For male, it's less than 34 centimeters. For female, it's less than 33 centimeters. They need to evaluate further step. And the questionnaire HARCS, they come from strength, assistance in walking, right from a chair, climb stair, and fall. If the score of this questionnaire is greater than or equal to 4, they have more risk to sarcopenia. So we need to go to next step is diagnosis. Diagnosis of sarcopenic obesity, there have including two of diagnosis, right? For obesity, we can use the body fat, percent body fat of diagnosis, and visceral fat area is one of the criteria that we can diagnose for obesity. But for sarcopenia, we need to diagnose by muscle strength first, hand grip dynamometer, knee extension strength test, gait speed test, and 5 times sit to stand chair test. Is very easy to test in your clinical practice because you can apply this test to your patient to make a diagnosis of the muscle strength. And next one, we need to find out about low muscle mass by body composition analysis. Body composition analysis right now we have two techniques. One is DEXA and another one is BIA. Because low of muscle mass in AWGS criteria, they use DEXA scan to diagnose for low of muscle mass. The criteria is shown like this. So we will talk again. DEXA or dual energy X-ray absorptiometry is a gold standard of body composition analysis because it can provide our information of body fat, visceral fat, muscle mass, and also bone density. But in our clinical practice, I think BIA or bioelectrical impedance analysis is very easy to do, and many of hospital and also clinic or wellness center we can use this method, this technique to give our information of body composition. BIA can provide about information of fat mass, fat free mass, percent body fat, and also visceral fat area. When you do this technique, you get information like this. They show many things in this paper. But one thing, if we need to diagnosis of low muscle mass, we need to focus on ASM. It's defined as the sum of muscle mass of the upper body, right arm, and lower body, right leg and left legs. And if we divide by height in meter square, we will get the new index. The index is ASMI. Appendicular skeletal muscle mass index is one of the criteria of diagnosis of low muscle mass. In AWGA 2019, they are defined as ASMI less than 7 and less than 5.7 is the criteria of low muscle mass of male and female, respectively. How about the guideline in Asian Japanese Working Group on Sarcopenic Obesity or JWGSO? They developed about guideline to screening and diagnose of sarcopenic obesity for the people from 40 to 75 year old. The first step screening of sarcopenia and screening of obesity. For obesity, they use the BMI and waist circumference. And screening of sarcopenia, they use the calf circumference, the questionnaire, fingering test, or UB Wacker test. This one is very interesting test. You can test for yourself, but it have limitation because sometimes some people there they have like the vary of calf muscle, so it should be used at only for the screening test. And diagnosis for obesity, they use visceral fat area greater than or equal to 100 centimeters square, and also percent body fat 20 and 30 for male and also female. And sarcopenia at the picture. And we go to the step 3 is staging. The staging of sarcopenic obesity is very simple. Stage 1, sarcopenic obesity without complication. And stage 2, there have at least one complication attributed to sarcopenic obesity or the complication that come from excess body fat or low muscle mass, such as your case or your patient, they have chronic disease, diabetes, dyslipidemia, hypertension, fatty liver, or any disability and movement disability and other such as cardiovascular disease and respiratory disease. They have the one of the complication or the risk. So in the people who have sarcopenic obesity stage 2, they need more intervention or the treatment because excess body fat come together with low muscle mass is very dangerous and is affect to our body, our health more than only uh, only obesity and sarcopenia alone, as I mentioned. And now we go to the prevention and treatment of sarcopenic obesity by the 4 pillars. We'll start with the nutrition because nutrition is the main pillar of the chronic disease treatment and also prevention. Nutritional plan, right now we focus on lower about the calorie, particularly from the refined carbohydrate, ultra-processed food, and also the dietary fat. We should increase about the high quality protein to our patient and amount of protein per day or protein requirements for a day should be increased maybe around 1.2 to 1.5 gram of protein per kilo of fat-free mass or ideal body weight per day and divide maybe for 3 to 4 meals a day, particularly in the people who cannot get more protein in the small meal. We need to divide for many meals and increase about the high quality protein. High nutrient diet is very important. We should choose about the complex carbohydrate, vegetable, fruit, and healthy and good fat from like the fish, from egg, from nut, and like the olive oil. Exercise plan, I recommend that we should make about the structural exercise plan for our patient, especially for the who have the problem about the muscle mass, because as we know, when we have low of muscle mass, we need to increase both of strength and size. Structural exercise program should be resistant exercise 2 to 3 times a week, and combined with aerobic exercise or cardio exercise and stretching. But it should be based on your patient or your case preference, because if they like of this activity, they can continue for a long term, or we call the adherence. And healthy lifestyle plan is very important. Sleep, hygiene, stress management, and medication or supplement, in some case they need to combine together for the treatment. For the healthy diet, caloric restriction by lower carbohydrate, lower refined carb, cut off ultra-processed food, and high of um, dietary fat is very important. Regular physical activity, resistance training 3 times a week, aerobic training or exercise, and also stretching exercise is very important, because we should to combine to the good nutrition. Sleep hygiene, stress management is like the pillar of the lifestyle intervention that we need to apply in our program to our patient too. And how about the putative therapeutic or the novel treatment for this condition? They have many of trial of study. They use vitamin D, calcium, hormone testosterone, and anamorin. Anamorin is some. So this treatment in the future we need more information, but right now it's not used as the standard treatment of sarcopenic obesity. In some case, they need medication to support about weight loss. They need bariatric surgery, and in the near future, I think we have the new medication or novel medication, especially myostatin or activin type 2 inhibitor, that can preserve and increase the muscle mass in the patient who have obesity. Multi-component exercise, functional exercise recommended, balance exercise, gait retaining, and resistance training is very important. Together with the healthy dietary pattern, whey protein, HMB, we can use in some case who cannot get enough protein, or they cannot get or eat more protein in the from the food, because maybe the problem about chewing, digestion, or they cannot intake of many kind of food. And I recommend the Mediterranean diet, because this is the dietary pattern style that is very good to our health, and it can support about the also hormone, muscle, and control about the metabolic function in our body. And summary and separate emerging and potential management strategy for sarcopenic obesity. Nutrition is very important. Lower calorie, lower refined carbohydrate, ultra-processed food, increase more protein. Exercise, we focus on resistant exercise, aerobic exercise. In some case, we need pharmacological therapy. GLP-1 and also GIP receptor agonist is one of the treatment that can support our patient, especially who have more body weight or excess body fat, to lose fat at the target goal as we need, maybe 10 to 15% or some case to 20% weight loss. Then they can maintain with their intensive lifestyle for a long-term weight maintenance. I think this one is more helpful and can support your case, your patient to keep their going on their healthy lifestyle, because in the first phase, in the third time, they can lose weight by their use medication together with their lifestyle intervention. Medical therapy, hormone replacement therapy, testosterone, selective androgen receptor modulator, or SARMs, as I mentioned, is one of the new treatment in the future, but we need more information. Myostatin inhibitor, um, tivargumab or bimagrumab is a monoclonal antibody action as activin type 2 receptor inhibitor. Is a novel of the medication. In the future, we will see many of weight loss medication that push the bimagrumab or tivargumab combination. During you have low fat, you can preserve or increase um, muscle mass. I think this one is very cool and it's interesting to support our patient, our case in the future to maintain or preserve their muscle mass when they have the weight loss plan. In some case, they need bariatric surgery, gastric, sleep, or lung or wide bypass based on their indication and patient status. And what is about the outcome? Our expected outcome for management sarcopenic obesity to our patient is to lower body fat, preserve or increase muscle mass, lower the fat in the muscle, lower inflammation, and increase physical function. Also, and also for quality of life to our patient. And finally, my last slide. Now we're talking more about the sarcopenic obesity, and you will see about the benefits of your skeletal muscle. So I cheer up and encourage everybody to invest in your muscle today, rib strength, good health, and longevity tomorrow. Thank you for your attention and thank you for your comment and your support for my first English exclusive podcast. And I hope we will have the new episode soon. See you guys. Thanks so much and have a nice day and have a good health.